Hello, my name is Ryan Terlouw. I'm one of the plastic surgeons at Muskegon Surgical Associates, and I'm here today to talk about breast reconstruction. So breast reconstruction is typically performed after a mastectomy or a partial mastectomy for breast cancer. After meeting with your general surgeon for your breast cancer care, most people are referred to a plastic surgeon to discuss the reconstructive options afterwards. There are several different options for you depending on the type of surgery that you have for your breast cancer. Many people will have breast conservation therapy, where you'll have part of the breast removed for breast cancer, and then have radiation therapy afterwards. The reconstructive options for this include a breast lift to rearrange the remaining breast tissue to give you a normal appearing breast afterwards. We'll often address the contralateral breast or the other side as a symmetry procedure so that you have good symmetry after your operation. The other option for breast reconstruction is after mastectomy. There are several types of mastectomy. You can have a nipple-sparing mastectomy or a skin-sparing mastectomy, and that is decided based on where your tumor is located and what your breast surgeon thinks is best for you. If you are not a good candidate for a nipple-sparing mastectomy, we can still perform nipple tattooing or nipple reconstruction. So women that have had their nipple removed for breast cancer reasons have two separate options for reconstruction. We can perform a skin flap to recreate the bud of the nipple. After that's been performed and your incision is healed after 6 weeks, you can have nipple tattooing. The nipple tattooing is a safe and very effective procedure for reconstructing the nipple, and this is performed in three-dimensional fashion now, so that as you look at it from the front, it actually has appropriate shading and all the appropriate glands around the nipple areolar complex. After a complete mastectomy, you essentially have two options. You can have implants placed to reconstruct your breast, or you can use your own tissue. If you decide to use your own tissue, you have two separate locations that you can use for donating tissue. You can use your abdomen or a tummy tuck type style procedure, or a muscle from your back. And when you meet us in the office, we can help discuss if you're a good candidate for this. If we decide that you're a good candidate for implant reconstruction, we can help you decide which implants and which size to choose. Approximately 80% of breast reconstruction is performed with a silicone implant that we have here. The implants are often placed at the time of your mastectomy if you're a good candidate for this. Sometimes we need to delay the reconstruction to allow your skin to heal after the breast tissue has been removed. If that's the case, we often proceed with breast implant reconstruction in 2 stages. The first stage will be placement of a silicone tissue expander that allows us to expand the breast tissue or the skin envelope in preparation for placement of a final implant. When the expander is placed, it's often partially inflated, and then we see you in the office, and on a weekly basis or an every other week basis, we add saline to the expander to allow this to completely expand your envelope until you reach a size that you're comfortable with. After you've reached your ideal breast size, we then plan for a second operation to place the silicone implant. The silicone implant is typically placed through the same incision from your breast surgery. Afterwards, you need to wear a surgical bra for approximately 4 to 6 weeks. You typically have a surgical drain that's left in place for approximately 1 to 2 weeks. And after about the 6-week mark, you have no further lifting restrictions. Like I said, every case is different. And this is a situation that we coordinate with your breast surgeon or your general surgeon. We'd be happy to see you in the office to discuss your reconstructive options.